Well, thank you for joining me today for the types of Medicare plans. My name is Susie Brown, so let's get started. So let's talk about the types of Medicare plans. First of all, here at Senior Benefits Consulting, we help people get additional Social Security. We help them with their health care so they get the biggest bang for their buck. We also help with additional benefits depending on what's needed for the person. So in our previous video, we talked about the parts of Medicare. We talked about Part A, Part B, and Part D, and how they all work together. In this video, we're going to talk about the two different kinds of plans, their approximate costs, and the pros and the cons. So let's talk about penalties for just a moment, because I don't want anyone to get hit with penalties. When you first retire, either at age 65 or over age 65, you do need to sign up for your Part B and your Part D, which is your drug coverage. If you don't sign up then and you wait, well, for Part B, it's a 10% penalty for every year you don't take it. And it's a lifetime penalty. So it'd be 10% more for your Part B for life. Um, that's per year. So if you go more than 1 year, it could be even higher than 10%. On Part D, it's 1% per month that you go without this. Now, they do give you a couple of months or more to pick this up without any kind of penalty, but you do need to be aware because you don't want to be stuck with a 12 to 24 to 36% penalty to pay for your Part B for life. If you have questions, please give me a call on that, and I'll be glad to walk you through it. So let's just pretend again for just a moment, all you have is Medicare A and B. And everybody asks me, well, why do I need more than A and B? Well, that's where this information comes into effect. If you just had Medicare A and B and you went to the hospital for something major, you'd pay $1,676 the moment you walked in the door. And there is no max out of pocket here to protect you. And you could pay this 4 to 5 times a year, depending on how often you go to the hospital. But let's say you're in the hospital. Well, that amount will cover you for the first 60 days, but let's say you get to the 61st day. Well, now you're paying $419 a day. But what if you make it to the 91st day? Well, now you're paying $838 a day copay. And once you hit 150, you're paying at 100%. So that's part A. Part B, well, when you pay that 185 or whatever it's going to be for 2026, the government's only going to be paying 80% of what we talked about: doctor's visits, testing, medical equipment, preventive services, and most importantly, outpatient surgery. So you would be stuck paying 20% for an outpatient surgery. And right now, outpatient surgeries are averaging somewhere right around $50,000. And about 70% of all surgeries now are outpatient. So to cover you both monetarily and health-wise, you need additional coverage. You need additional coverage to protect you. So again, we talked about this is only partial coverage for Medicare A and B. There's no spending cap, so you don't have a max out of pocket again to protect you. There is no drug coverage or very minimal drug coverage with just Medicare A and B. You would pay the 20% on the Part B, and there's no dental, no vision, no hearing coverage or over the counter, period. It's just literally hospitalization and doctor's visits, testing, medical equipment, preventive and outpatient services. So there are two ways to get more health coverage, but you must have Medicare A and B to have either plan. So let's talk about the first one. Medicare Supplement, also called GAP, was the original Medicare plan that came in 1967 to help cover the gaps in coverage that Medicare A and Medicare B have. Now, how this works: you would have your Medicare A and B, where you're paying the $185, and it could be up to $205 in 2026 for your Part B. Then you'd have a supplement, and the one that you would want to use, which gives you the majority, the richest benefits, is the G plan. There are several different kinds of supplement plans, but the G plan is the one that gives you the richest benefits. Those average something somewhere right around 145 to 150 a month. And then you need a drug plan, and those go anywhere from $0 all the way up to $111, depending on the plan that you have and the medications that you take. Now, the supplements and, of course, the Part D plans are all offered by private insurance companies, and they're going to pay the costs that are most of the costs that original Medicare doesn't pay. So let's pretend that again, you have Medicare Advantage, Medicare Supplement plan, and something happens. Well, if you have a G plan and you go to the hospital, you would pay zero. If you go to the doctor's office, you'd pay the first $257 as your deductible, and then it's covered at 100% for the rest of the year, as long as it's something that's medically necessary. Some things that they don't tell you about these plans is that both your Part B and your supplements go up each year. Now, the supplement plans prior to COVID were creeping up about 4 to 5% per year increase. Since COVID, they can range anywhere from 9% increase all the way up to an average of 23% increase per year. You would need a separate dental plan or vision or hearing plan if you wish to have those benefits. But as for richest benefits, the G plan is considered the best bet. And all G plans are all covered exactly the same per Centers for Medicaid and Medicare. So you're not going to find one G plan that's many times different than another G plan with another carrier. It's kind of like shopping for a car. You're going from place to place looking for the best price for that car that you want. And then once you do get it and you get the good cost on it when you purchase it, now you're looking for service. And that's where we can look at all the different G plans offered in each state. So let's look at the second kind of coverage. It's called a Medicare Advantage plan, and it works completely different. A Medicare Advantage plan works very similar to a plan you may have with your employer, except there is no deductible, only a max out of pocket. But every single thing is a copay. Now, the monthly premiums on these plans can be anywhere from zero up to $69 to $70, depending on the plan that you have. But every single thing's a copay, and it includes hospitalization, doctor's visits, drugs, but can also include dental, vision, hearing, and over-the-counter, depending on the plan that you choose. So let's just say you decide you want a PPO, which allows you to pretty much go to any doctor you want as long as they will bill. Now it's called courtesy bill. As long as they will courtesy bill the company or the carrier that you choose, then you will be covered in a PPO. On an HMO, of course, you would need to stay in the network. Then there's the special plans. There are C-SNP plans called chronic plans. That's for people that have diabetes, a heart problem, and maybe COPD. That's a special just for them, and it does help keep the costs down. And some of those plans are $0 plans. There's the D-SNP for those that are Medicaid and Medicare, and there's the I-SNP for people that are in a nursing facility. Again, many of these can include dental, vision, hearing, and over-the-counter, but every single thing is a copay. Let's say you go to the hospital. Well, you'd have a copay. It could range anywhere from $295 to $350 a day, 1 through 5 days or 1 through 7 days. That applies to your max out of pocket. Max out of pockets can be anywhere from $3,900 all the way up to $9,000, depending again on the plan that you choose. Doctors, you'll pay a copay. Whether they're in the network or out of the network, you'll pay a copay. Now, some plans out of the network, you do have to pay a percentage, such as 50%. So that would be something you would need to look at. We would need to check that. Drugs, they all offer drug plans, and they all have tiers because the Centers for Medicaid and Medicare oversee all of that, and they tell the carriers how the plans must work. Again, you can have dental anywhere from just cleanings all the way up to $3,000 to $4,000 a year for dental. hearing, you can go and get hearing aids for a discount with just copays. Workout, you can go to many of the local gyms and work out for the basic. Now, if you want a fancy class such as a Zumba or a bike class, you would have to pay for the class, but you would have a free basic membership at many of the local workouts. And of course, again, there's over the counter. Some plans offer you over the counter monies each quarter to buy things in the pharmacy that are not prescriptions, such as Band-Aids, aspirin, vitamins, etc. Some do not offer that. It just depends on the plan that you're looking at. But you have the two different plans that work completely different. On a Medicare Advantage plan, you can choose each year during October 15th through December the 7th which plan you wish to have January 1. And if you're not happy with that choice, then you have the legal right to make a one-time change January 1 through March 31st. Now, on a supplement, which is the one we talked about previously, you only get a one-time shot to go on that plan with no health questions asked, and that's when you first retire or you're turning 65. On a Medicare Advantage plan, having a health issue doesn't matter because none of that counts. They don't care whether you have a health problem or not. On a supplement, if you have a health issue, you get the one-time shot to go on with no health questions. After that, if you wanted to change, you would have to go through underwriting or wait till your birthday. Here in Oklahoma, we have the birthday rule. Some states do not have the birthday rule. So just be aware that on a Medicare Advantage plan, you can change from year to year, or if you move outside of the state or something else happens, there are special enrollment periods that allows you to make a change. On a supplement, you get a one-time shot when you first retire, either whether you're turning 65 or you're over age 65 retiring, to pick up a supplement with no health questions asked. After that, if you wish to make a change, you would have to go through health underwriting. And if you have any questions on this, we're happy to answer that for you. So I guess the question for you is, which way do you want to get coverage? Which way seems to fit your needs the best? That's what we want to help you with. Now, there are other rules and factors that you need to consider. And if you're looking at any of these plans, you do need to check for specifically for the Medicare Advantage plan. If they're not checking your doctors, your drugs, and your pharmacy, then the person you're working with as an agent is not doing their job. And you do need to check that every single year because plans do change on a Medicare Advantage, not the supplement. But a Medicare Advantage plan, they do change. The copays change, the max out-of-pocket changes. It depends on what Centers for Medicaid and Medicare approve through the insurance carriers. Now, we want to make this easy for you. We want to analyze your situation so you get the coverage you feel is what fits you the best. We want you to avoid costly mistakes, and we want to save you time and money. That's our goal here at Senior Benefits Consulting. So if you have a question, please call us at 405-246-0305. Or you can go to our website, which is sbcmedicare.com, and set up an appointment. We're happy to answer any questions you may have.